Winter influenza has been going around here in South Korea, especially at schools. And as we head into the first official winter since COVID-19 was declared endemic, what can we do to stay strong and healthy? For more, let's turn to Dr. Ali Stan this morning. Welcome back, Doctor.
Thank you for having me.
I know this is a very basic question, but Doctor, I have to ask you, what is the difference between cold and flu?
Right, so every flu season I get this question asked a lot. In terms of difference, it's caused by different virus. So influenza is caused by the influenza virus, and the cold can be caused by a number of different viruses, such as rhinovirus or human coronavirus. In terms of symptoms, the flu usually is very abrupt in onset of symptoms, and the symptoms can be quite intense. Whereas with cold, I often say, nobody dies of a cold. It's more of a winter nuisance. We'll have symptoms primarily in the nose, nasal symptoms such as runny nose, stuffy nose. We feel kind of crummy for a few days, but it goes away. Nobody dies of a cold. It doesn't progress into a more severe disease. The flu, however, can be quite severe. And in terms of the symptoms, as I said, they can be quite intense. So typically we'll have a high fever, headache, muscle aches, sore throat, cough, and people are feeling miserable. I've had very healthy, strong people come in to me in the clinic and just, they're exhausted. They're so tired, they can't go into work. The thing with the flu as well is it can progress to pneumonia, it can progress to heart disease, it can lead people into the hospital for admission, and it can also be fatal. Nobody dies of a cold, however. And so there are a couple of differences, but as I said, there's overlap in symptoms. Sometimes it's hard to tell. So if you are not feeling well, you have high fever, and the symptoms are prolonged, say more than 3 to 5 days, then you may want to go and see your doctor and get checked out, because that's really the only way to differentiate between the two is to get tested.
Right, it sounds like flu is whole another level from having a cold. Now, some people who have recovered from the flu this season are arguing that the flu was worse than coronavirus. Now, Dr. Tan, is that so? Is flu really harder to recover from than COVID-19?
I think it's case by case, because there are certain groups, certain populations who are prone to having severe symptoms. So for influenza, children, small children, infants are prone to having severe disease. Also pregnant women and people over the age of 60, 65 are prone to having severe disease when they get influenza. So if the person that you spoke to was in one of those age categories, and certainly we would expect that they would have a hard time recovering from the flu. Also with COVID, now, it's been in circulation in the world for more than 3 years. Most people have had at least one episode of COVID, and we've built up a certain amount of immunity to COVID. And so when people get COVID these days, most of the time the cases are mild. And so I think there's just a difference in terms of who you're talking about, in terms of their immunity status, and then their condition overall, whether or not they've been vaccinated as well.
Definitely. That's the thing. Flu in children is apparently hard to spot because symptoms like high fever, like you mentioned, are not as prominent or noticeable. What's the reason behind that?
Well, I think there's a spectrum of symptoms that are possible with influenza, but some pediatricians this season have reported seeing cases of what they're calling stealth influenza. In other words, the child will not necessarily have a very high fever, maybe just a mild a fever. They'll have a cough that lingers for days and days and days, and it's not really detected that it's influenza, a case of influenza, until the mother brings a child in to get tested, and then they discover the diagnosis. And the problem with this, of course, is during this entire time that the child has had symptoms, they're spreading influenza to their classmates, to their friends, to their peers, and then unfortunately, adults can also get infected. And then if it's a high-risk adult who gets influenza from the child, then it can lead to a serious case of influenza.
Definitely. The thing is, it's very contagious. Now, health experts, medical experts, including you, Dr. Tan, are advising people to get vaccines for both flu and COVID-19. I've talked to numerous experts about this. Are you on the same page?
Absolutely. So, but it depends on if you're on, you're in that high risk category. So we recommend seasonal influenza vaccination for children between the age of 6 months and 13 years, for pregnant women, and for the elderly and people with chronic diseases. Everyone should get a flu shot. And if you haven't yet, this is the time to get it. And unfortunately, in Korea, as of October 19th, only about 25% of young children, pregnant women have gotten their influenza vaccine. The vaccination rate is a little bit better for the elderly. It's 43%, but you can tell we have a long ways to go in terms of protecting our population from what looks to be a particularly severe flu season. And I say it looks like it's going to be severe because the baseline level of influenza cases in the community is still quite high, and it's been high. It's very strange. It's been high for almost a year now. But we're seeing a spike in people who are admitted because of influenza, so with severe influenza. And this rise in admissions due to influenza is starting about a month earlier than last year. And so I'm very concerned that people are not adequately protected. The same thing goes with COVID. There's an overlap in terms of who's at risk for severe COVID. And so getting the booster, the most recent variation of the booster, is a good idea if you are elderly, if you are living in a high-risk situation. In terms of whether or not children should get vaccinated, every country has their own guidelines. In the U.S., they recommend the new COVID booster for anyone greater than 6 months of age. In Korea, it's more in line with the flu recommendations in terms of who should get vaccinated for COVID this year.
Sure. All right. Thank you so much, Dr. Tan, as always, for your insight. You have a great day.
Thank you.